my name is Samantha Simonetti, and I'm a student physical therapist here at Campbell University. Today I'll be talking to you about the seated flexion test, which is used to see if there's any asymmetrical movement in the PSIS. So here I've got the spine to show you a little bit more specifically where the PSIS is located, which is the posterior superior iliac spine of the pelvis. And when we palpate it on the patient, you'll see we're actually going to place our thumbs just below that landmark. We're going to be looking for movement of the posterior superior iliac spine during flexion. The patient will be flexing on the treatment table, and we're going to feel to see if there is asymmetrical movement and if they've got a superior movement that is greater on one side versus the other side. That would be considered a positive finding, in which case we would say that they are anterior innominate. So I'm going to start off with step-by-step how to perform this test, and then I will go into a patient explanation, and after that I will talk a little bit about the science behind this test. So Phil, my patient, will come over real quick. In this case, just so that we have better camera angle, I'm actually going to have him facing away from the camera. You're going to have your patient seated on your treatment table. Normally, the examiner should be standing behind them. You want your body mechanics so that when they flex forward, you're in a good neutral position. For the camera, I'm actually going to kneel down to show you where the PSIS is located. So here we've got the PSIS. You're going to come down from the iliac spine and you're going to find a little divot there. That's the PSIS. You want to make sure that you're palpating both while they flex down and come up. And you're feeling for the motion and seeing if there's any asymmetrical motion throughout and seeing if there's any superior motion specifically. So Phil, can you flex down for me? Okay. And then come back up. Good. And you would have the patient perform it at least twice so that you can feel for that motion. I'll have you do that again, Phil. Go ahead and flex down and come back up. So in this case, for a patient explanation, I would explain, Phil, due to the pain that you've been having in your low back, I want to kind of rule out some of the joints in your low back. By ruling them out, I'm actually going to perform a series of tests of motion just to see if there's any pain with any of that motion and see if you've got any restrictions back there, okay?
Okay.
So in this case, with this particular test, I found in the literature that whenever you're performing any pelvic obliquity tests, you should be performing several of them because this test by itself has a very low reliability and validity score. You want to also use either a standing flexion test, supine long sitting test, or a prone knee bend test. And that prone knee bend test will also help you to determine whether the patient is actually having a actual leg length discrepancy. There was also one study that specifically talked about the changes in the innominate tilt after manipulation, and that was written by Sibolka, and they've actually determined that the combined test of a Gillette, which is a standing test, with the seated flexion, they found greater results. So I'm going to perform that test one more time for you, so you're going to make sure that you find those PSIS, palpate both of them, have your patient flex. Go ahead and flex forward for me, Phil. And come back up. Did you have any pain with that? And he did not have any superior movement of either side of the PSIS.